It's time for Medical Moments with Covenant Healthcare, and today we're talking all about heart failure. We're here with Dr. Mayar Jundi. Thanks so much for being with us today.
Thank you for inviting me.
So let's first talk about what heart failure is and what can cause it.
Heart failure is failure of the heart as a pump to deliver blood to the organs of the body. And what patients feel usually because of that is shortness of breath, fatigue, inability to do things they used to do. For example, walking 1 mile sometimes can take them multiple times of stopping in order to finish 1 mile. And if the symptoms are severe, minimal tasks, for example, just going from the bed to the restroom at night or during the day might be very difficult, and they have to stop multiple times. These are what most of the common symptoms the patient feel with heart failure.
So something very important to pay attention to. And what are some factors that make some people more at risk than maybe others?
Well, the risk for it is usually heart attacks, uncontrolled hypertension, diabetes. We divide the reasons for the heart failure into 2 major categories: because of heart attacks and reasons are not related to heart attacks. Heart attacks usually damages the muscle of the heart, making the heart muscle weak. And we have other reasons, for example, uncontrolled hypertension, uncontrolled diabetes, toxins, for example, certain chemotherapy medication can make the patient's heart fail. Because of that, it happens to certain pregnant women for unknown reasons, and the list is really, really long. Those are the major reasons for what we call non-ischemic heart failure.
Gotcha. So is it something that's treatable at all?
It is treatable. There are multiple types of treatment. The majority of the treatment comes with medication through pills and other things. There are certain devices we implant in the patient, such as certain pacemakers, defibrillators. There are certain devices we implant in the patient to monitor the patient and direct our medical therapy. And of course, if all of that fails, there is transplant and certain pumps implanted in the heart.
So now I hear you have a certain program that's pretty unique at Covenant. Why don't you tell us about that?
Sure. We started the program recently. The program consists of physician, nurse practitioner, and actually I have a physician under training with me. And we have a lot of people contribute to that program. People work behind the scenes, such as case managers, social workers, administrators. And the program unique because we take care of the patient on the inpatient and the outpatient. And the outpatient is actually more important than the inpatient because those patients live outside. And the goal for the treatment is to improve the quality of life of the patient and decrease the rate of death. The death with heart failure is very high. One of those chronic diseases that over 5 years, the death rate is 50% in spite of all the technology and the advancement we have in heart failure. And we have certain devices we can send the patient home with, where we can monitor the heart rate, we can monitor the weight, we can monitor the pulse, and we can intervene earlier on in order to prevent admission to the hospital, to prevent decline of the patient's condition and improve the quality of life.
Yeah, the prevention and what life after the hospital, very important.
Very important. Remember, the patient live outside the hospital, not in the hospital, so it's very important to concentrate on that piece. And we put a lot of effort at Covenant in order to monitor those patients and try to improve their quality of life and hence decrease the death.
All right, well, thank you so much for talking to us about heart failure today. Very important information everybody should know.
Thank you.
We appreciate it so much. And if you'd like some more information on today's topic, head over to the hot links section of WNEM.com.